My name is Aleksandra Czesak, and I'm skilled as a dialysis nurse at Maastricht University Medical Center. I'm a part of Vascular Access Group, and together with other colleagues, we monitor fistulas and dialysis catheters of our patients. We work on daily basis with a vascular specialist, and we provide advice and training for our colleagues, dialysis nurses. Today, I want to share with you our newest development in the field of anesthesia during fistula cannulation, together with my knowledge about pain factors. You are welcome for a short presentation about pain reduction during cannulation when using Buzzy. Pain and fear are actually very normal and useful emotion that a person can experience. It helps us to avoid danger and protect ourselves. The dialysis ward is not necessarily a ward where the danger hides, but we do cannulate fistula on a regular basis, and let's be honest, that can be painful and frightening for the patient. When you regularly come in contact with a procedure that you experience as painful, this experience is stored in your pain memory. Pain memory works as well as an elephant memory. The next time you feel pain, this memory is activated and you may experience more pain than the last time. Pain leads to more pain. Don't forget that the shunts are the most safe and common dialysis access. 83% of all population of hemodialysis patients of the dialysis ward of MUMC have a fistula. One of the anesthesia methods that we present to our patient is an EMLA ointment that they had to apply at least 1 hour before cannulation. We also use ultrasound accompanied cannulation to assure as little miscalculation as possible to release cannulation stress. Our ward invested lots of resources and bought recently 3 new echo devices to improve the dialysis experience for our patients. But we noticed that even some more experienced patients were not always being fond of cannulation with the dialysis needles. Lots of patients complain about pain and stress-related symptoms during the punction. That despite our effort of making cannulation as painless as possible. In 2019, our colleague did a study on pain and fear during cannulation of the fistula. We were astounded by outcomes of her study. 43% of the patients experienced pain during the cannulation despite using the EMLA ointment. To improve the situation of our patients and decrease the pain and fear during the cannulation, we looked for other solutions than EMLA ointment. Our colleague, Nurse de Boer, took a look at the pediatric ward and learned about a device that helps children with the fear of cannulation called Buzzy. But what is Buzzy and what does it do? Buzzy was intended in 2006 by Dr. Amy Baxter, a pediatrician and a pain researcher. Buzzy is a small vibrating bee with blue eye-specked wings. It is already being used in various pediatric departments in the MUMC. He helps block sharp pain and provides distraction when giving injection of other medical procedure. The device is based on the gate control theory and the descending inhibitory controls. The gate control theory of pain suggested that the spinal cord contains a neurological gate that either blocks pain signals or allows them to continue on to the brain. Unlike an actual gate, which opens and closes to allow things to pass through, the gate in spinal cord operates by differentiating between the type of fibers carrying pain signals. Buzzy can ensure that the spinal cord cannot transmit 3 stimuli, namely cold, vibration and pain, to the brain at the same time. Cold and vibration take precedence over pain, making the pain stimuli feel weak. Buzzy confuses the body's own nerve system and distracts attention away from the pain, thereby dulling or eliminating sharp injection pain. In the same way, the rubbing a bumped elbow helps, or cold running water smooths a burn. Buzzy was intended for the pediatric wards, but seems suitable for other populations like dialysis patients. So after many discussions with the nurses and nurse practitioners at the pediatric ward at MUMC, Nurse de Boer, together with the members of the vascular group, decided to implement Buzzy at the dialysis ward. What I think is worth mentioning is the fact that the dialysis ward at the MUMC was the first dialysis ward in the Netherlands that was using Buzzy for the adults. But how we use Buzzy? Take a look for yourself. We made for you following presentation. Today we are cannulating shunt with help from Buzzy. First, we have to provide cold blue ice pack wings for our Buzzy. They have to be stored in the refrigerator. Then we have to inspect the fistula. Our golden rules are see, feel and listen. So we check for any abnormalities of infection. Then we place Buzzy at the future puncture site of the fistula. Buzzy is then activated by pushing a small button off the top of the device. Buzzy has to be placed on the shunt for at least 1 minute to bring necessary effects. After minimal 1 minute, it is placed above the puncture site and remains active during the puncture. We like to say that we are putting Buzzy between the brain and the pain. After the first puncture, we repeat the same action for the second time for the venous puncture site. Buzzy can be used at the same time with an ultrasound and won't give and vasoconstriction in the shunt. What our results are? We are now past the implementation phase and we see that the patients who start using Buzzy are satisfied and want to continue with it. We can say that the best results are achieved by using Buzzy in combination with an EMLA ointment. We also see that the use of the pain relief methods has changed. The use of lidocaine spray has decreased from 36% to 7%. We are positive about the results. We noticed that the subject of cannulation fear has come out of the taboo, both among dialysis nurses and patients. There is more understanding for puncture anxiety. Puncture fear in dialysis patients is an underexposed problem. However, fear of cannulation can contribute to a lot of suffering by patients. Puncture anxiety and Buzzy deserves more media attention. That is why we are glad that our work about Buzzy has been published in various magazines and regional newspapers, which we are very proud of. We would not be able to achieve these effects without a pediatric sedation and analgesic team, for which we are very grateful. Also, a great remarks go to our dialysis nurse, Elisabeth de Boer, who was the ambassador of this project. Thank you.